Melasma is a problem of hyperpigmentation, which mainly affects women because it's driven by the hormone estrogen, as well as UV radiation. And it affects a lot of women, especially who have olive or darker skins. And primarily it looks like a bit of a patchy, dark pigmentation around the cheeks, upper lip, which can be pretty distressing for a lot of women, as well as between the brows and the forehead. Melasma typically only affects the face, and it can be distinguished from other forms of pigmentation by its nature. So it basically looks like a slightly asymmetrical pattern, and it's confluent in some areas. It's sort of more of a patchy type of pigmentation, and it's a very, very difficult pigmentation to treat. It's almost impossible to cure yourself of melasma, and I think that's a very important thing I try to explain to all my patients. We see it a lot in people with skin types, what we call Fitzpatrick 4 to 6, which basically means people who have olive to dark skin, but it does occasionally occur in people with fair skins, but not so much. Typical nationalities we see with melasma are sort of Asian, European, Indian, those sort of races are the most common. Melasma is particularly hard to treat because it's influenced by the hormone estrogen. So females obviously have that circulating around naturally. And the other thing is, a lot of females take the pill, which also is an external form of estrogen. So this can also exacerbate melasma. So the first step would be to address any of those issues, which would be to maybe try a different brand of pill, or let's say a low dose estrogen pill, or progesterone only pill, or some other alternative forms of contraception. We all are exposed to the sun, but in those with melasma we have to be particularly careful of avoiding sun on the face. We generally have high SPF sunscreens that we recommend. However, the most important part is to be consistent, I think, to put it on every day, even if it's raining or it's not really sunny. If you have melasma, you really need to put it on every day. And that's not just going to be good for your pigmentation, but also good for anti-aging. And the other thing with sunscreen is to make sure you put on a couple of layers. So it's not just putting on one layer, but it's like painting a wall. You paint it once and there's always a few spots which you've missed, so you put another layer on. We use serums or creams that contain substances which block tyrosinase, which basically means that it's blocking the production of new melanin. We have things like hydroquinone or things like Kligman's formula. We also have a cream which we like called Lytera by Skin Medica, which is excellent for blocking that first step, to stopping that enzyme which produces melanin. The next step is to flush out what you have. So it's no good just blocking tyrosinase, but you also need and melanin production, but you also need to sort of turn over the skin and really get rid of the pigment that's there. And that can be done in a couple of ways. The most common ways we do it really is to use a vitamin A or topical retinoid. So retinoids are one of the few creams which are proven not only to reduce wrinkles, but they also do this by turning over the skin. So if there's a lot of skin turnover, your skin is acting like a younger skin. But for those with melasma, it's great because you're turning over that melanin in the melasma, and you're turning out that, getting rid of that pigment. The other ways you can turn over the skin or flush out existing melanin is with laser. And laser is a double-edged sword with melasma, so we use it very, very carefully. The importance of that is also that most of the patients we treat with melasma are those with olive or darker skin types, which generally are much more difficult to treat with laser because we have a lot of competing melanin naturally found in the normal skin. So with laser, the rule of thumb is to use very, very light treatments, and we don't want to flare up the pigmentation. And generally we use Q-switch Nd:YAG lasers. Sometimes we use other lasers like the Fraxel, but most of the time we would use the Q-switch Nd:YAG lasers, which are lasers which have very short pulses, and they basically literally go in there and break down the pigment and cause a little bit of skin turnover. The other thing you can do for melasma is you can have the occasional light peel, chemical peel that is. So again, you have to follow the same principles. You don't want to traumatize the skin and make things worse. So generally the peels we use for melasma are things like lactic acid peels, or something that can be tolerated by any skin type. And again, that exfoliates the skin, helps flush out any excess melanin or pigmentation that's unwanted. Finally, the other treatments we can use for melasma are things we can use to treat melasma from the inside out. So these include medications which are very effective, such as tranexamic acid. We use it at very, very small doses, twice a day, and basically this helps to block the production of melanin in response to UV radiation. So we find this to be one of the most effective treatments. The other modality of treating skin pigmentation and melasma is also to use intravenous vitamin C and glutathione. So we've often treated people using this method. The downside is having to come in every week to have a session of intravenous therapy. But the upside is it does actually really brighten the skin as well as lighten the skin. So you get total skin lightening and also improvements in pigmentation. In conclusion, melasma affects a lot of our patients, especially our female patients, and it can be quite devastating for them to have this pigmentation which they constantly have to cover or avoid, going out without makeup. And we find that we can really put a lid on it and get it down to a level which is acceptable to them, where they feel more confident and more comfortable in their skin. It makes a big difference to those who have it. It can be a life-changing thing to have this reduced for them.